Hello, I'm Louise Chun from Welldoing. To celebrate 10 years of matching people with therapists, we have launched the Welldoing Inspiration Awards. We want to recognise the people, businesses and brands that have been an example to others in the area of mental health and wellbeing in the time since we launched. I want you to meet here Mark Harris, who is nominated psychotherapist and founder of Talk for Health, Nicky Forsythe. Hello, Mark. Hello, Nicky. Good to
Right.
see you both. Uh, Mark, I wanted to ask if you could introduce yourself and give us a bit about your background in the area of mental health.
Yep, sure. So my name is Mark Harris. I've worked for community centres. I've run a community centre, two community centres. Run a youth club. I've worked with SEN children. I've worked for approved premises for ex-offenders as well, also. And in all of this, all of the type of work that I've done, everybody was coming from a place of not knowing how to express or share themselves, how to express how they feel in life. So I'm not actually from the field
Mm.
of mental health, but I'm from the field of life.
Yeah.
I'm from life because I live everyday life with people on the streets. So that's where I'm from. And I'm real with people and people are real with me. So yeah, that's
And how did you first hear of Nicky and Talk for Health?
well, someone actually introduced Talk for Health to me and said that it would be a good thing to introduce to the people who I work with. In my own personal life, what actually drew me to it was I've lived in children's homes, I've lived in hostels, I've had so much turbulence in my own life. And because I'm working with these different types of people as well, also, the model of Talk for Health for me was it just helped me learn how to speak. So a friend or another person who was a trainer of Talk for Health, who I actually met, he turned around and said to me, Mark, this would be great for you to actually do with the work that you do with people. So that's how I got kind of brought into it. I done the course and wow, I was blown away. I was Words can't even explain the magic that is created in my life. It really is yeah, it's amazing. Yeah.
And
Yeah.
could you say what inspired you then to nominate Nicky and Talk for Health for this award?
Yeah. So what inspired me was that Nikki has put together an unbelievable system. I wouldn't even use the word system. I use the word of, I choose to use the word of loving yourself and loving others. And how she's put that together and being in her presence as well and working with her on a one-to-one basis, she's, makes me feel included, makes me feel, you know, I would have never believed in a million years that I would be working or talking to somebody like Nikki. Not in my world. That doesn't happen. But being in that environment and what Nikki's put together, it's just a ripple effect for me because I ripple it out. And it's just created such a positive effect on myself and people around me. So, yeah.
That's great, Mark. Thank you. Now, Nicky, congratulations on your award. Can you please introduce yourself? And you're now going to need to tell us, what is Talk for Health? What is it that you've done that's been so impressive to Mark?
I'm Nicky Forsythe, and I'm a psychotherapist and the founder of Talk for Health. And what Talk for Health is a group peer counselling program that I developed for myself and a group of peers while we were training as psychotherapists, actually in this very room. And the whole premise was that to give everybody time to share, as you would in a therapy session, and then to get skilled feedback from your peers. And I found the little group that I ran to be more powerful than any therapy that I'd ever done. And I thought, great, let's turn this into something for other people. So it started being offered to other people in 2008. And in 2012, we became a social enterprise, actually, no, 2013. And we were commissioned by the NHS and supported by grant funders to run the program and to run a network of ongoing groups. I mean, I probably better say, on the program, everybody, it's a 4-day program, which runs usually 4 Fridays, and people learn some key skills. Sorry, there's a train going by. There's nothing I can do about that. And those skills are sharing truthfully about your own inner emotions, as you would do in a therapy session. But then also everybody learns to feed back to each sharer using counselling skills within a defined framework that we use called OmniSpa. And then people also learn a kind of recipe for an ongoing group. So once they've done the 4 days, they can just go on meeting and everybody has time to share, everybody gets feedback. And we demonstrated over 10 years that that approach is as effective as therapy in lifting well-being and reducing depression.
That's fantastic. And was this started in London?
Yes, it was started in London and it's remained in London, though we do have we have had participants from all over the UK. Yeah.
Yeah. And how did you feel when you found out you were nominated for a Welldoing Inspiration Award?
Well, obviously, thrilled and honoured and excited. It's wonderful to be on the receiving end of this kind of thing.
But the timing is difficult, isn't it, Nicky? Tell us about what's coming up very soon for
Yeah.
this inspirational business of yours.
Yeah, so very tragically, we're going to have to cease at the end of June. We have a funding crisis. The NHS funders of ours we had been in a long conversation about potentially rolling out across 5 boroughs locally, and we'd also been in conversation with government about rolling out nationally. But neither of those things has happened. And we were informed 2 weeks ago that our NHS contract would come to an end at the end of March 2025. Sadly, that's meant that other funders have had to withdraw their support because they could see that we were no longer going to be financially viable as an organisation. So, I mean, it truly is terrible, actually, for all the, I think it's more than 1,000 participants who are still involved. Yeah.
And these people, they come to you, they're self-referring to say, I want to take part in this program. Yes?
They either get referred by GPs or psychiatrists or psychiatric nurses, or they refer themselves. Yeah.
And what would you consider to be the most significant achievement in Talk for Health up until now?
Well, I think there've been 2. I think one is demonstrating, really decisively that this raises well-being and reduces depression, actually with a large effect size and over the long term. So that's really crucial because NHS therapy, usually you get 6 sessions, you might feel a little bit better, and then you relapse afterwards. More than 50% of people relapse. And then, of course, winning the Mental Health and Wellbeing Award for long-term impact in 2022 was a huge achievement, and that was lovely. But the biggest achievement of all is just the creation of a community where people, feel so grateful for the support.
And how do you measure the impact on individuals? Do you stay in touch with them so that you hear from them and you know how they're doing?
Yeah, we had a very good system designed by a guy at Roehampton University who's now a fellow at UCLH for measuring our impact. So we have to also to report to our NHS funders, measure people's well-being beforehand, at the end of the program, and then until recently 3 and 6 months later. And we've used standardized measures that the NHS use, like the PHQ-9, which looks at depressive symptoms. And we also have been using the WHO 5, the World Health Organization 5, to measure well-being. And something called the UCLH4, I think, to measure people's sense of loneliness and belonging. And people have, people's well-being and sense of connection has all increased, using those measures. Yeah. It's a bit nerdy, isn't it, all this?
No, but it's you then have proof, so that's
Yeah.
incredibly useful.
Yeah.
I mean, what if you could wave a magic wand, Nicky? What would you do?
Well, I think a bigger we have tried this. A bigger charity with much more infrastructure needs to absorb Talk for Health, really. That would really be the way it would carry on. Or, we'd need to start again and start charging people for it, to have quite a big trading element so that those who can pay for it do pay.
I wondered how you maintain your own mental health and wellness while supporting others, which can be quite a challenge, yes?
Yeah, absolutely. So, I mean, anybody who is working in the therapy field, usually I have had my own therapy and supervision, and also just actually the support of wonderful people in the Talk for Health community, exercise, yoga, all of those things are really important for mental health and well-being. Yeah.
Mark, I wondered if you could talk a bit about the kind of community element of Talk for Health when you did the program and when you've introduced other people, knowing that people can, who live in your area or whatever, have this opportunity. How does that strike you?
Yeah, sure. So I'm just going to put it out there. Being a black man, I've always been taught not to share, not to speak, just hold everything in. And in the groups that I go into, it's just mostly my first ever group was just men. And it was mixed men, black, white, all different types of people. And men are not allowed to speak. We don't know how to share because we're taught not to share because we're going to be judged. Every course that I've done for Talk for Health, from start to finish, whether it's men or mixed group, but mostly men, they all come away saying that something has changed inside of them. They feel connected, they feel loved, they feel wanted, they feel they can express, they feel that they're not being judged. And having that, I didn't know it existed. I didn't know it was there. And I came to it free. I didn't have to pay. So the impact that it creates for men in general, words can't explain. I cannot explain. Because for me, Talk for Health is more about a feeling. It's the feeling on the inside. My words might not do it justice, but as I speak, what's going on the inside is, it hasn't got words. It hasn't got words. So yeah, that's how it is for me.
But thank you for those words, Mark. Would you say, Nicky, that this is the kind of quality of response you've been getting over those years you've been doing it?
Yeah, I mean, there is just this huge sense of community. So now there are, I've lost count of 2,500. I think it's around 2,500 people who've been through the program. And people there's a network of 30 ongoing groups, and then we're running one community event every month. So anybody who's done the program can go to any of those groups and any of those events. So what emerges is this huge sense of community. And that is, that's, I think, the thing that people in the end value most highly. Like I have these groups that I can go to, and then friendships that I make. Yeah, I mean, And we know that loneliness is extremely harmful. Loneliness is worse for you, I think, than smoking and heart disease. So it combats loneliness as well. Yeah.
And I mean, in terms of everybody talks more, you know, certainly in the time since I started Welldoing, which is the time I met you, Nicky, all those years ago, 10 years ago, the amount of words spoken about mental health and well-being have, you know, blown up. It's been such a topic. But do the two of you feel that things are getting better?
I mean, I can say I don't think they are. So unfortunately, what's happened is that mental health awareness has turned into a lot of awareness of diagnoses. So really, you know, I did a project in schools where young people could all tell me what diagnosis they thought they had, but they couldn't, you know, talk about their feelings or connect with others in an effective way that would be good for their well-being. And I would say what's happened with the raised awareness of mental health is that there's just lots of raised awareness and nowhere to go. You know, there simply isn't, unless you're well off. And you can go into, you know, a really good therapy for a long time. That there's simply there's awareness, but there's nowhere to go.
Personally, for me, you know, with the work that I do, I've seen a lot of people are just suffering. Everybody's screaming out for help, but they don't know where to go for the help. You know, there's so many people out there who need groups like this. They need a place to talk about whatever they want to talk, just get it out of their chest. But nothing, it seems as if it's like a pressure cooker is just building up. It's like there's so much pressure. And I speak for myself. Before I'd done Talk for Health, my pressure was taken out on my family, where I'd have arguments with my children or sometimes with my wife. But with Talk for Health, it got off my chest. And since COVID, there's been so many government cuts. But this is a service that must not be cut.
Well, we're very pleased to be able to give you some publicity with this and with your award, Nicky. And thank you, Mark, for talking to us today. And congratulations, Nicky. And I'll keep my fingers crossed that some, you know, savior will come riding in, and or government department or something that will help keep it going for longer with more people being able to help. So lovely to see you both. Thank you.